In terms of incontinence, Richard, is what I would like to mention to you is that the 5% of people that can end up with incontinence long term. I did mention to you that there's a possibility of a 1% chance of a sphincter, but also in a more milder form of urinary incontinence after the surgery, what we can do is we can put a sling procedure. The sling procedure is a relatively new technique of dealing with urinary incontinence after surgical treatment. And what we do is we would put a sling device which would, I'll just show you here on the diagram. So the sling device would be wrapped around the urethra close to the bladder, and what it does, it's like a hammock. So if you think of this as the urethra, this is like a hammock, and it lifts the urethra against the pubic bone. So basically what it does, and it stops any leakage. So it increases the intra-abdominal pressure, it increases the intra-abdominal length of the urethra, that is, the amount of urethra that's inside the abdomen, so that increases, but also it increases the pressure on the urethral wall, which then stops any leakage. So it's a very neat device, and you don't need to fiddle with a sphincter that has been the only treatment until recently.
But how do you urinate with that sling then?
With the sling in place, you go and urinate normally. Okay. So you don't need to, like with a sphincter device, you would need to go each time that you go to pass urine, you would need to deactivate the sphincter.
Oh, okay.
So whereas with the sling, you just go normally. So you don't have to do anything. Just go there normally. And the beauty of the Argus sling device is that it is adjustable.
And that's another operation, is it?
So that would be another operation. Yeah. And as I said, if for example the sling is not tight enough, what we can do is, instead of redoing everything, what we can do is we make 2 small cuts on the side and readjust the tension on the actual sling, and that will basically then lead to full continence.